Moving on, next we're going to have a staff member of ours, Melissa Gerard, who's our community events organizer, speak to us about advocacy and how we can all be a part of this journey. Thanks, Melissa.
Give me one moment to get my slides pulled up. Perfect. Hello, everyone. My name's Melissa. You all, I've probably met a few of you all already. I'm also apologizing. I am a certified yapper, and I've talked too much, so I'm losing my voice. One of the things I love about coming to the symposium is the community and getting to talk to so many of you all. I get to email you all and talk to you all throughout the year, but face-to-face is so much different. So if I talk next year, I need to talk on the first day, so I'm not hoarse during the presentation. So I'm going to be discussing advocacy. So what I get to do with the foundation is communications, marketing, events, lots of fun things. But all of it kind of goes into advocacy work and how we can all get involved, how community members can get involved, and how we can build awareness for the mesothelioma community. So what exactly is advocacy? The textbook definition is the public support for or recommendation of a particular cause or policy. Essentially, it is bringing awareness, bringing support to a particular cause or policy. And we do that every day. We're doing that right now. And to be an advocate, you just need three things: to be able to connect, to be able to communicate, and to be able to collaborate with each other. It's that simple. Anyone can be an advocate. It does not take a certain person to do that. It takes differing skill levels, differing passions, differing time commitments. So throughout the presentation, I'm going to show a few different paths that you can take in advocacy, and I'm going to talk about some examples of people in our community and how they advocate, and maybe be able to give some inspiration if you're thinking. We've had a lot of people stop by the table out front and say, I want to do something. I want to get involved. I want to be able to help out. I'm inspired right now. I'm feeling passionate. What can I do? Hopefully this presentation will give some ideas for you and be able to spur some conversations. We'll be out at the table afterwards, so feel free to stop, talk to myself or our development manager, Carolyn Shields, and we will point you in the right direction. We'll talk about what you're into, maybe figure out what your pathway is. When it comes to mesothelioma, advocacy is outrageously important. A lot of times whenever I meet someone and they say, what do you do? And I say, I work for a cancer research and patient services organization. And they're like, Susan G. Komen? I feel like that's the first thing I hear. And I'm like, bit smaller, less pink. And then I start talking about mesothelioma, and the first thing I say is, like the commercials? I'm like, yes. It's a bit more complex than that. And that's one of the biggest things, is that we are under-recognized. We're a small group, we're a mighty group, but the circle is small. And it's important for us to have that kind of recognition. We need that research that breast cancer gets, that leukemia gets. And so when people say mesothelioma, they're not thinking of the law commercials. They're thinking of faces that are in this audience. So we want to build that level of awareness and advocacy so that people think of patients and they're not just thinking of that law commercial with that word that we don't really know how to say. Because afterwards they're like, is that how you pronounce that? And I'm like, I don't care how you pronounce it as long as you remember it. It's also very misunderstood. There's a lot of stereotypes. We are meeting patients and families all the time and hearing stories, and I can't tell you how many times people say, well, we went to this doctor and they said I had this cancer, or they thought I had this. Well, I had surgery for this and they found out it wasn't that. And so the more awareness and advocacy we have our mesothelioma specialists, but there's a lot of oncologists in small towns that have never treated a meso patient. And so we've had patients say, I went to my oncologist and they were like, we've never seen anyone like you. We don't know anything about this. Or I remember a peritoneal patient telling me that their oncologist said, isn't that a lung cancer? So having these things more well-known, the awareness is there in the community, and the stereotypes aren't there. We had a patient also say, when I first went in, I'd started hearing things about mesothelioma. I kept asking, and they said, well, you're this age, or you're this gender. You can't have this. And our group is outrageously diverse. You can see it in the faces that are here and the people that you've met, that this does not discriminate. It's across ages and genders and races, and that's very misunderstood outside of the community. And like I said, it's misdiagnosed. And so we want to get that advocacy out so that more people know. So like I said, there's going to be multiple pathways, and I'm going to cover 4 broad ones. There's obviously more than that, but that's what we're going to highlight. So we'll talk about awareness, especially through social media. We'll talk about fundraising and events, governmental advocacy, and then peer leadership and support. So awareness and social media advocacy, like I was talking about, that circle is small. And I feel like we have a small group. In the United States, there's about 3,000 people diagnosed with mesothelioma, and that group is small. A lot of times, people don't know what it is unless they're affected by it directly. They have a loved one or they're diagnosed themselves. We want to build that circle out. So we can do that easily by what connects us the most, and that's the internet, and use our social media following. So if we as the foundation post something out, most of the people that follow us are you all, or the people that are watching online. But that's a small circle. But say Cynthia reshares it. Well, her circle's a little bit bigger, so it's getting bigger. And then if we get Claudine to share it, if we get Heather to share it, it gets really big. And so we can really grow that circle bigger and bigger, and then the awareness grows. Because I'm sure there's hundreds of people on your social media that you may not have talked to in years. I know that's me. When I posted about working here and I was posting about one of the fundraisers that we were doing, I had someone reach out to me from high school, hadn't talked to in years, and they said, wait, my next door neighbor has this. I need to connect you all. And it's those little connections that really help build that spider web out. And so this is easy. You don't have to be an expert. I'm sure some of you are looking at me and saying that skill level is not beginner. I hate social media. You already made me get an app. Now you're talking to me about Facebook. But it's as simple as creating a profile. John Anderson's done it. He's on Facebook now. You can add him, begrudgingly. But you don't have to create anything new. We post a lot. You can look through September. We posted a ton for Meso Awareness Day. As soon as we get back from the symposium, I'll be posting videos from the symposium, photos, resharing some of your all's things that you put into guidebook. Those things will be on the foundation page. Feel free just to share those things out to your friends. It can also go up a notch, and you can create your own content. There's a few people here that I know are already creating their own content and talking about those things, whether it's their journey as a patient. I know Jessica's in the room. She had a blog for a little bit, still going, about her journey and what that looks like as a mom who's a survivor. I know Heather creates a lot of her own content over on doing Reels and TikToks. I don't know if Jen Winder is in the room. I know she talks a lot about her journey through bereavement. And so there's a lot of people that are making content that want to share the foundations, want to jump on theirs. We're all in the same family. We're all getting that word out there. So this time commitment is flexible. It's what feels comfortable to you. And like I said, it's not always creating new content. If you're starting out and this is intimidating, sometimes it's just sharing things that are already there. And so a few examples, these are some things that we post and that are easy to share. We have little quick facts, things that a lot of people may already know. To you all, this may be like, well, duh. But when it's shared out to other people, they don't know. I can't tell you how many times I've posted a random fact about asbestos and people are like, wait, what? And in my generation, there's so many people DIYing and doing renovations, and that's an important thing to think about when you're buying a house that was built in a certain time and redoing it. We also share a lot of stories. We've recently started the More Than Meso campaign that focuses on patient and caregiver and bereaved stories to show that people may have mesothelioma, but they're a lot more than that. So getting that out there and seeing what the face of mesothelioma looks like. We also share a lot of educational content. We have our Meso TVs that Julie brings in different guests to host. And they're great segments that we have on our YouTube, we share on our other social medias. We also have Meet the Meso experts that we share, where we sit down with physicians or lawyers to really give you some in-depth information that way. Our next pathway is fundraising and events. And when you think of fundraising, you think of fundraising dollars. That's great. That's how we advance research. That's how we do travel grants. That's how we are able to have patient services. But more important than that is that awareness, because we're always talking about how to grow that circle. And a lot of times that circle can be grown locally. We have a group that sets up booths at their local farmers market sometimes. And they just call us and say, hey, can you send me some brochures? I made a tablecloth. And we send out some marketing information, and they just set up and they just talk about meso. They talk about their family that is affected by it, and then they talk about how someone in the community could be affected by it. And they say all the time, they say somebody comes in and says, well, wait, this sounds familiar. I have a friend who's going through something. They can't diagnose it. Maybe, and it might not be, but it's always that information that can get there. Skill level with this, it can be easy, it can be more advanced, and it can be a one-time commitment or it can be ongoing. So the easiest of these, we have Facebook fundraisers. Facebook makes this really easy. If you all are interested in this, you can stop by the table out front and talk to myself or Carolyn about this. But you can go into Facebook. We are a licensed nonprofit in Facebook. It's your birthday, you're celebrating something just because. You can easily go in, you can set it up. You don't even have to write anything if you don't want to. It like pre-programs it all in. If you want to put your personal story in, you can. It will automatically share it with your friends and say, this person's birthday's today and they're bringing awareness to this. Would you like to donate? That simple. And then Facebook will automatically transfer those funds over to us. And if you're curious about it, you can check in with Carolyn and she can let you know, yes, we received this, this is what it looks like. She can also get you totals for those things if you're wondering exactly how much it raised, all of that. We also have something similar through our own website. So we have our fundraising and tribute pages. This is actually Mackenzie, who we all heard from last night. This is her father, Doug Thomas. So this was his fundraising page. He was in the Army, and her family created this page in his honor. It's super simple. You have control to set this up. Carolyn can also help you set this up. I know there's a lot of people in this room that already have their own pages. I know Heather does Lung Leaving Day through this. Carla, I'm pretty sure you have a fundraising page with your family. Super simple. If you feel like this is a lot, once again, we can help you through it. Carolyn can help set the page up for you. And it's simple. Set your goals, share it out. Super easy. We also have in-person fundraisers. This is a little bit more of a time commitment, but it can start slow. A lot of the events start out as I have this, I'm a patient and my friends want to celebrate me, or my father passed away and I want to celebrate his legacy through this. We had a fundraiser that started out as a golf event where Literally a group of friends just went to golf because they used to golf with their friend, and then years later it turned into something much more. This example is the M for Emily. It happens in South Carolina. They are on their 9th year, and they have gotten so big that they're raising over $50,000 every year. Did not start out there, but they've gotten with their community, they've done these things. But start small, it doesn't have to be giant. Our board member Bill just started his event, and we ate lunch together the other day, and he was like, well, next year I'm already set, I'm gonna be bigger. Like, I already have my plan, he's figured out, what he needs to change. So every year it's just growth over growth. Start out simple, and we can help you. If you have something or you wanna do something and you're unsure, reach out to myself or reach out to Carolyn. We can get on a call and say, here's what we've seen in the past. Here's what we've helped do in the past. I've put on a lot of events. This is fun. I like to talk about it, think of fun things that we can do, different ideas of what we can do, what you're passionate about, what you're skilled at, and we can help come up with some things and help you think about maybe those little devil's advocate questions that you don't think about, of details that may fall through. You can also partner with businesses. You can partner with your own company. If you work for a corporation, contact them and say, do you do anything where you do partner giving? And they may do that. Some people will, some businesses will say, we'll match you. If you donate this amount, we'll match with you. You can also do creative pledges. For Meso Awareness Day, the foundation did a matching challenge where we had a donation come in, and we tried to see if we could match it as a community. You all matched it, don't worry. We triple, quadrupled it. But we also saw some fun things. Claudine, I hope you don't mind me using you as an example. Claudine did a match of her own. I saw on her social media, she was saying, if you donate, I'll donate what you donate. And so she did a pledge on top of a pledge. This family actually does something great in their community. They partner with a local restaurant, and for the month of September, they put out flyers talking about it, and they sell t-shirts. It's advertised at the business all month. So when people come in, they're asking questions. The servers are talking about it at the restaurant constantly. And then on Meso Awareness Day, they all get together in memory of their family member. They're all wearing blue. Anyone who stops in the diner who's not part of it is, what's this about? Tell me more about this. They sent me so many pictures for Meso Awareness Day. They had hundreds of people here for this event dressed in blue doing this. So it's as simple as that. Is there a place that you go to eat all the time and they know your name easily and you're like, hey, what about this? The worst they can say is no. The next pathway is governmental advocacy, and I know this can seem daunting, and so we'll talk about how this can be easier. Sometimes it can be local. It doesn't have to be going to Congress and doing these things. Sometimes it can be as easy as attending a city council meeting, which can sound like a lot, but if you, for Meso Awareness Day, a lot of our community has proclamations at the state level, at the local level. You can request your city to proclaim September 26th as Meso Awareness Day. And then you can say, hey, can I come in person? A lot of times at city council meetings, they're wanting people to come in. They're wanting to hear from the community. They want other people to speak. And it's a great way to get in front of a group that might not have heard about it, share your personal story with them. You can meet with other local groups. I have a friend that works for my local fire department, and I was talking about where I worked and how it can affect firefighters. And she said, tell me more, I didn't know this. And so we start talking about it, and we were actually talking about their trainings. I don't know if your all's local fire departments do this, but when there's like a building that's gonna be torn down, they end up using it for training practices, and they're in there doing all types of things, training with equipment, climbing, doing all of this. And I was asking, are you masked all the time? What are these buildings? When was that building built? And after that conversation spurred, she actually invited me to come talk at one of their meetings and do a training just about asbestos safety. And then what does that look like if there's members of the fire department that maybe have retired, but maybe start showing symptoms of something, where to point them to, what direction. So it's simple conversations that you don't think are much, but that turn into awareness and advocacy. We also do national advocacy. We will do pushes through the foundation. You all may have received emails asking to contact your Congress members at times. Some of that is easier, I should say. It can be letter writing or phone calls. We can also script that for you all and send out sample letters or sample scripts to say on the phone. You don't really have to think about it. You can read it off. Really, it's important for your Congress members to know that there's people that live in their communities that have this. They need to know that this is important. They need to know their stories. You can also go to your local Congress member's office, whether they sit in the House of Representatives or in the Senate. If it's easy for you to get there, you can go in person and talk to them while they're in town. Usually their websites have an easy place to contact or a phone number that you can get in touch with and say, when are they going to be in town? Find out when they're going to be in town or in DC, set an appointment, talk with an aide. Don't get discouraged if the Congress member doesn't want to meet with you. I'm going to be honest, the aides get the work done. That's who you want to talk to anyway. It seems less official, but they're putting the paperwork in front of the person to sign it. They're the ones pushing the things through. We will be doing in-person advocacy over the next few years too. We're looking at what that looks like potentially next year, and then we love getting together when we do our symposiums in DC to do advocacy in person on the Hill. That's what this picture is from, is the symposium in October of 2023, where we took a group to the Hill and got to go around and get in person and get in front of people and really get things done. And it really changed things. That year, mesothelioma had gotten left off the list for the CDMRP, and that was our fight. Get us back on there. And it happened. Our New York delegation came back with a phone number for me, and I called them right then. And then Chuck Schumer's office came back and said, let me talk to these people. And then I gave them all the contacts for all the other aides that we had talked to. And conversations got started and we got in. And it was powerful. It was powerful that we went in person and told those stories, and it did something. The last thing is peer leadership and community support. And so this takes a little bit of skill for the sheer fact that it takes a little bit of empathy and compassion as we talk to each other. But I think most people in this room have that. But it does take a regular and ongoing time commitment. And it looks different. Sometimes it's just connecting. I know a lot of you all are on social media, maybe already in our Facebook groups. If you're not in our Facebook groups, talk to one of us. We can get you in. But there's great connections happening in there. We're always moderating in there and looking in and seeing people saying, I'm going in for my scans tomorrow, wish me luck. And how much just love pours in those comments of good luck, you know, seeing it all. What I love the most, though, is when those people are checking back in. Hey, I know you had scans the other day. How did it go? Do you need to talk to someone? And that not just listening when they say it, but that connection back is so important. This can also look like mentoring newly diagnosed patients or their caregivers or even newly bereaved. Our 3 community honorees last night, I feel like, exemplify this so well. I know they're constantly meeting new people. I mean, Heather's been meeting new patients for years and leading them through. Julie talks about Shane, and anytime there's someone that he could match with saying, hey, Shane, can you call this patient? I need you to talk to this person. And this has gone on through the foundation and our community for years. I know when talking to the Moscas, they talked about how they would go and sit in living rooms with new patients and caregivers and talk them through. I know John and Bonnie were doing this all the time, just going and meeting with people and holding their hand and helping them through. And sometimes it doesn't have to be mentoring. Sometimes it can just be a connection and a friendship and someone to kind of do the journey with. We can help with this as well. We do have a peer-to-peer program, so if that's something you're interested in, Julie and Teresa can get you connected with someone and help this process along. And sometimes it can be speaking at different groups. And it could also be joining our community advisory board. That's a lot of what they do. They're holding a leadership position. They're being a place that, as patients are coming up to us, as people in the community are coming up to us here and saying, I want to get involved. I'm like, let me get you to a community advisory board member. That is the greatest place to start. And so it could be joining that as well. Everyone is an advocate. It doesn't matter who you are. And advocacy can happen at any level. I know it sounds scary. It sounds like I don't know where to start, but that is the thing. If you take anything from this, that anyone can do it. And every action matters, no matter how big or how small. I felt this photo was fun to use. I don't know if she's in the room. I think these are Madison's dogs that she shared with us, and I just thought it was the cutest thing. So here's what I'm asking of you all. Do one thing. Look at the paths, whether that's social media, whether that's fundraising, whether that's governmental type advocacy, or whether that's becoming a leader in your community or a peer mentor. Pick that path. Start with something small. Maybe it's going on our social media and sharing something. Maybe it's taking all those beautiful pictures and things that you all have put in Guidebook and sharing it on your social media. You already have the content. Just sharing it. When you leave the symposium, talk about it. Maybe it's writing a letter to a Congress member, just sharing your story, letting them know that, hey, I'm here. You all have already done this once, so you can mark it off the list. You're here, you've attended an event. But we post about fundraising events all the time, and we have people connect that way. I know one of the events we posted about around Meso Awareness Day, they said, well, we had someone show up, and I didn't even know him. They found out about it through the foundation, to Bill's event, correct? Yep. And so Bill got to make a new connection in the community, and he didn't even expect it, but we sent it out and said, hey, Bill's doing this. He's in Michigan. Stop on by. So that's my ask of you all. And if you need any help, feel free. That's what we're here for. We want you to connect with us. We want you to be on our social medias talking with us. Email us, reach out. My email's on here. If you have specific questions about donations or fundraising, I can connect you with Carolyn. But we would love to talk to you all. Thank you all so much.
Do you already have a date and a location for next year's conference so that I can plan to be at my second conference?
That's a great question. We actually will be sending out a survey today. We do have ideas. We try to keep it in October. We want to keep it the same so that people can prepare, but we're trying to determine our location. Every year we kind of go all over so that we can get the most amount of people and make it easy for people to travel to. If they can't make it this year, maybe next year's will be an easier place. So there's a brief survey that's going to be going out today, so you all can do that, and then we'll be working behind the scenes as quickly as possible. And you will definitely get an email, and it'll be all over our social media of where we're going and when. But that'll be coming very soon. And I hope you will be there for your second one. Yes, Claudine.
Thank you for mentioning the Community Advisory Board. I just wanted to just quickly say, if joining the board feels like too much, a big part of what we do is provide programming ideas to the foundation for events like this, and also the wonderful Spotlight series that Julie organizes. So if it's just as simple as sending me an email or a note saying this is a topic that I think would be a really interesting thing for us to discuss in the future, like that would be so helpful because we can get that message through. Thanks.
That's who we're going to first. When we're planning the symposium, we as a staff come up with ideas, and we literally go straight to the Community Advisory Board and say, what do you think? Does this sound good? What do you all want to hear? So any ideas of the Community Advisory Board is so helpful for us.
What is the focus or a topic? You know, like every year over the, actually, for a few decades, I've been coming to conferences. And, you know, as for the patient registry, you know, we were lobbying to get something accomplished. So I was wondering this year, what is the focus? Is there a project
when it comes to governmental
No,
advocacy.
we're not in DC.
Correct.
And we would go to lobby, focusing on a bill or something.
Right. So we do have focus. What I was saying when we were talking about governmental advocacy, it's kind of two parts. One is storytelling, keeping people in our mind. We usually also have an ask. They want you to have something that you're coming for. Sometimes that's research. Like I said, the CDMRP, which is congressionally directed research medical programs. It's done through the Department of Defense. And mesothelioma gets included in that because we advocate for it. So that's a lot of times where we're focusing on. If there's an asbestos bill, these are things we're trying to constantly keep up with. Earlier in the year, there was a question of an asbestos ban being turned over, and then it didn't get turned over. And I think a lot of that had to do with advocacy that we put out. We were discussing it. We had people calling. We had people going after that. So that's something that we're constantly watching. Right now, with where the government is in budgeting, we're mainly trying to focus on what's getting funding. Are these research programs still getting funded? Are places like the National Institute of Health currently getting funded? Are patients going to still be able to go there? So there's an array of things that we're constantly keeping an eye on. So at this moment, we don't have a point thing, but we're keeping an eye on that. So as time goes on, we're always ready to get the community together, get them engaged, and get started on whatever we need to when that thing comes up. John?
Is it on?
Yeah, you're good.
I'm going to talk about the Community Advisory Board for a minute. I'll be quick. He's a yapper. I'm the double yapper. Will everybody on the Community Advisory Board stand up? If you have ideas, thoughts, or anything you want to go to all the other people in the organization, contact us. Talk to us here, ideas. You see who we are. We're always discussing things. Once a month we meet, we talk, we work with the foundation. They help us, we help them, and we help you. What I like so far with this meeting this time, there's a lot of faces here that are smiling now compared to when they came in the other day. There's a lot of sad faces, confusion. That's what we like.
Thank you, John. And really, the Community Advisory Board is a beautiful thing. They really are helpful. They're a great group overall. So please reach out to them. That is all for my presentation. We are about to take about 20-minute break. We have snacks in the coffee and conversations room. I think it's beignets this time. I'm excited about that. But we are wanting to get a good picture of all of the patients. So we have Brandon, our photographer, back at the backdrop. So if you're a patient, before you run to get a snack, if you will meet him at the back of the room in front of the backdrop, we're going to get a fun patient picture of everybody together.
A big group photo. So
Thank you.
come back.